Hey everyone, it's Dr. Charlotte Hodges, and I wanted to start part 2 of my What to Expect series. So part 2 will be how to ensure that you will have a successful perioperative period. So meaning, how are you going to have a successful stay on the day of your surgery? So first and foremost, I hope everybody did their preoperative diet. For every surgeon, they might have varying lengths of time. For me and my patients, I have them do full liquids up until the night before surgery. Then they can't have anything else to eat after midnight. Now, different surgeons do things differently on the day of your surgery. So you need to consult with your surgeon if you are not a patient of mine. For my patients, I am now going by the new anesthesia guidelines that say that on the day of surgery, patients can have clear liquids. That would be coffee. Guess who didn't like that idea? Patients can have coffee, tea, juice, broth, milk. You can do those things up until 2 hours before surgery. So typically, when someone is going to have surgery, they're given their surgery time and they're asked to present to the hospital 2 hours prior. That way they can get checked in, get in the pre-op area, get their IV placed. Hang on one second. There's a bunch of construction going on in our neighborhood. So anyway, so most people need to present to the hospital 2 hours prior to their surgery time. What I tell my patients is you can have clear liquids up until 30 minutes before you're going to leave the house to get to the hospital. And this will actually give you a good 2.5 hour buffer if you're doing liquids. The other thing that I do for my patients is I give them a small tablet called Amend, and it really helps with post-op nausea. It can be pricey, so I tell my patients to use GoodRx, and if their insurance tells them that it's going to cost an arm and a leg, a lot of times they can use GoodRx, and they can get a much more reasonable price. I have found a tremendous impact in a positive way if my patients are able to take Amend. I cannot speak more highly of it. It's a great drug. And consequently, it was actually first used for patients before they would receive chemotherapy. We now know that you can use it preoperatively, and it really helps with post-op nausea. So, day of surgery. Nothing to eat or drink after midnight. The morning of surgery, you can have your clear liquids up until 2.5 hours before surgery. So stop your clear liquids 30 minutes before you're leaving to head to the hospital. Take your Amend. There are going to be some certain medications that patients can and can't take the day of surgery, and your doctor will discuss them with you, and I'll also discuss them with you during your preoperative visit. Some things to pack. I always recommend maybe pack some slippers. If you want to bring your own pillow, bring a house coat. Nobody wants to get mooned, and I know that you don't want to be giving everybody a show from the backside. Now, typically what nurses will do is they'll just put a second gown on your back, but nothing's better than your own robe. So I do encourage patients to bring their own robe. Bring your own toothbrush, bring your own toothpaste. That way you just feel a little bit more like home. For all my patients, I usually just keep them in-house overnight, and they're able to go home after lunch the following day. And that's even if they've had a great big revision. Patients are always going to recover much, much better at home. I always tell my patients you can shower the day after surgery. You are going to feel so much more like yourself if you can shampoo your hair with your own shampoo, you're using your own soap, and you're in your own duds at the house. The other thing, you need to make sure, I'm going to get on the street, hang on. You need to make sure that you are walking after your surgery. We'll actually get you up walking the morning of surgery, or pardon me, the day of surgery. Walking is the single most important thing that you can do. It is going to help keep your lungs open so that you don't get a pneumonia. It is going to keep your legs and your vessels walking and open so that you don't get a blood clot. More importantly, it's really going to help you with pain and with nausea. I will tell you, if you're a patient that is not walking, you will hurt more, you will be more nauseated, and your staff, your doctor, and your nurses will be much more frustrated with you. You have to walk because, spoiler alert, surgery hurts. It just does. We're going to do everything that we can to, of course, control your pain, control any nausea that you may have, but in the end, you're not going to be completely pain-free. Another little side note is there is a big push in a lot of hospital systems, and it's also being supported by ASMBS, for us to go as opioid-free as possible. So I have implemented a couple of non-opioid treatments and my preoperative and postoperative plans while you're in the hospital. So don't be surprised if your nurse is giving you medications that are not a traditional opioid, because A, they've been found to work. I'm not going to give you something that doesn't work, but also know that there is a big push. And so some medications in some facilities just might not be readily available. 1 second, going by. There's a real pretty church right in our neighborhood, and it's adding a whole bunch to their sanctuary. So, I lost my train of thought. So bring some of your goodies. Walk. Oh, one other thing is, you're probably going to burp. You are not going to pass gas the first day after surgery. In fact, you might not have a bowel movement for a couple of days. In my practice, you do not have to have a bowel movement in order to be discharged from the hospital. However, I do encourage patients to take a stool softener if they haven't had a bowel movement a couple of days after surgery. So I hope that this has helped. I'm really excited for all of my patients. I really want y'all to have a good, successful surgery. It's life-changing. It's the best decision that you've made for you and your family. So I hope that this helps. Have a good, successful day. We are all praying for you. We are just behind you 100%, okay? Share this with your friends. Don't forget to subscribe and give me a thumbs up, okay? Bye.